Hey everybody, this is Dr. Thomas. I'm going to talk a little bit about the procedures that we do in our clinic and some of the tools that we use to do those procedures. So today I just removed some sutures from a forehead of one of our patients. Suturing is really common and we do it really often. So people cut themselves all the time. This child actually cut himself on the corner of something sharp like this at his home, like a bookshelf corner or something. Really common, the corner of the bookshelf went into the front of the scalp, so we used some suture material. We technically used 6-0 suture material. I really like this suture material because it's so fine and it's so thin, and it does really well for these tiny little facial lacerations. So this one I used for a face or a lip laceration. Earlier in the summertime, I saw a man who cut himself with a piece of barbed wire. We're in Detroit. Sometimes these things happen, and we use this 3-0 suture material to remove that barbed wire, or to soak that laceration from the barbed wire. To remove the suture, I use this what's called an 11 blade. This is called an 11 blade, and it's got this really pointed end on the tip. And what I do with that is I use a pair of essentially tweezers, and I pull away at the arms of the suture material, and I go underneath that suture material and lift away from the body with this blade, so there's no chance of cutting the patient. If I'm doing a procedure where I need to cut into like an abscess or a cyst or something like that, or typically for cyst removal, I'll make a nice even cut with a 10 blade, and that gives a nice even cut so that I can go in, use some tools to remove a cystic structure and take it out of the body. If I need to drain an abscess, oftentimes I'll use the 11 blade to drain an abscess. And so those are some of the tools that I use. In addition, there's different needles I can use. So let's say somebody has a pretty large abscess, or let's say a ganglion cyst. I might use an 18 gauge needle to remove that ganglion cyst or that abscess, paired with like a 5mm syringe. I might try to suck out some of that fluid by using a syringe like this. Alright, that's all I'm going to say for today. This is Dr. Paul Thomas with Plum Health DPC here in Detroit. We do a lot of procedures out of our office, and these are just some of the tools that we use to do those procedures. Thanks so much for watching, and have a great day.